All right. Well, I'm here with Dr. Lipov.
Hello, nice to see you.
Dream team. And thank you for speaking with me today because
It's my pleasure.
what I really, hope to do is just get more information about the stellate ganglion block out to more women so that they understand how it can help them, how it might benefit, their sexual health, how it might benefit their fertility, postpartum, things like that. And so I have a list of questions prepared for you. But what I would love for you to do for people listening that have no idea who you are, if you could just share a little bit about, who you are and what is the stellate ganglion block?
Sure.
Yeah.
So, my name is Eugene Lipov. I'm a physician. So, I finished medical school in '84. So, it's been probably way before a lot of the people who are listening who were born. Anyway, so I started as a surgeon, and then my mother took her life when I was an intern. So, as soon as I got out of medical school, 3 months later, my mother was dead. So my father had severe PTSD from World War II. So he gave that to her, and that's called secondary PTSD. The whole concept is that you can actually catch PTSD from your partner. I think it's a powerful concept because a lot of patients we treat it's like, we've never been to war, we've never been raped, yet we have this condition. How could I have it?
Yeah.
So we can talk about that.
Yeah.
Anyway, so an interesting set of circumstance. I went to anesthesia. Then from there, I became pain physician. So basically, back pain, leg pain, whatever. And I've been doing this procedure called stellate ganglion block since 1987, which is essentially an injection in the neck, targeting a group of nerves that go from the chest to the brain, or fight or flight nerves. So the first time that block was done medically was 1925. So it's been around quite a while. So I was able to figure out it worked for hot flashes, and I published on that. And then it was working very well, but the concern was we didn't know why it worked. Mm-hmm. So I tried to figure it out. I was able to figure it out. And then in the process of that, I figured out that this block would work with PTSD, post-traumatic stress disorder. We can hopefully change relatively soon. And then what it turns out is when we do an injection in the neck, a lot of times in 5 to 10 minutes, people feel much more relaxed, like we just did your friend. Uh-huh. And maybe you can describe how she's feeling.
Yeah.
But it could be almost immediate and can last for... Thank you. Thank you very much. It can last for months or years, and it gives you an opportunity then to get psychological intervention. It's much more effective at that point. And then your whole body, you kind of get your body back. You get to sleep better, you get to rest better, you can have better sexual function, you can have higher fertility, and I'll tell you a cute story about that. But I think that's pretty much why we're talking, I think, today.
Yeah, it is. No, and thank you for explaining that, because I think, at least for me, and just for listeners that don't know my story, I came in to get the stellate ganglion block. It was basically about 6 months ago now, which is wild that it's been that long. But for the first, 3-4 months, there were certain things for me after getting the block, right, that kind of came up to be healed. And certain things,
You got access to your memories that were just hiding there. Right?
Yeah, that were hiding that I could never have access to otherwise. And so some symptoms got worse before they got better, but now I'm free. And now I'm free. And I'm more confident. I sit up taller. Like I'm a different person. And it's because I was able to, I had access to the parts of me that were so repressed and so wounded from, different things through childhood. So it's just, I'm such an advocate for this. Yeah. And I really want to bring it to more women and couples in general too, that are on their fertility journey as well, because I think from a sexual health perspective, there's also a lot there that we could speak to. So I would just love if you could share maybe a little bit more about how this might help couples that have been struggling with fertility, or maybe that have even tried IVF and all the things.
Sure. So I'll give you my favorite story about that. So I took care of a young man who was, he's 42 probably. He was a fireman, or he still is a fireman in Seattle, I believe. So he came in, we did a procedure, and then we did a procedure on his wife. So because they had primary PTSD, which is he had PTSD, and he gave it to his wife. That's how I understood it. Anyway, so he does well. He goes away. He calls me 2 years later. And I was like, how are you doing? He said, oh, I feel great. He said, well, I said, why are you calling? I was like, you never know, right? So he goes, well, you don't know that, but my wife and I have tried to conceive a child for 15 years without success. So right after the block, this is when we conceived. And we calculated, when our daughter was born. So my wife got pregnant the day after the procedure. So guess what they named the child? It's a female. Beautiful blonde girl.
What?
You want to take a guess? Take a guess. It's funny. It's not bad. People think, Stella, no. Eugene, definitely not. Thank God. No, they called her Jordan.
Okay, yeah.
For Michael Jordan.
Okay. Yeah.
Isn't that cute story?
Yeah.
So it turns out, actually, I've been interested in that fertility for a long time because it's actually very detrimental for those people who have gone through that. I've had that in my family, so I'm very familiar with that. Anyway, so there was a paper written in 1972 in Italy where they found women who were infertile and they did the procedures on them. They did stellates then. 50% got pregnant.
50%.
Which is a large number. What it turns out that stellate actually changes how pituitary works and other hormones work and all of that.
Yeah.
So that's, if you think of that's way before,
yeah,
a lot of the modern treatments.
Totally.
Right?
Yeah.
And especially if women have like spotting or, difficult periods, that seems to synchronize a period. Right?
And yeah, and I can even like,
that happened to you?
Yes, as a testimonial myself, like that's now have regular periods.
Well, let me tell you why that happens. Though. It's kind of interesting. In order to get pregnant, so uterus has a lining. It's called endometrium. So it's kind of weird that male is telling you. I don't have the same equipment, but hopefully I learned something about school, right? Yeah. Anyway, so in order to get pregnant, the lining needs to be 8 millimeters or thicker. So it needs to be thick. So if the fight and flight nerves are overactive, as women start to build up that lining, they squeeze the nerves. Arteries, when those arteries are squeezed, the inside gets sheathed, and that's what a period is. So the lining of the endometrium come out.
Yeah.
But if the sympathetic or fight or flight nerve is high, it's always on. So you're always spotting. So you can never build up that 8 millimeter thickness.
Yeah.
Right?
Yeah.
So if you can, also the mood improves. So hopefully you get significant improvement in mood.
Yes.
So if you're really angry or pissed off and you're anxious and you haven't slept, you probably don't feel like sex anyway.
Yeah.
And hopefully this improves orgasmic function. In order to get pregnant, when women have orgasm, it actually sucks up the stuff from the inside of the vagina. Yeah. So it increases the chance of fertility.
Yeah.
So it's really not really crazy science. It's very straightforward. All it is fight and flight.
Yeah.
Because if you think about it, if you are a caveman and there's a tiger sitting outside, you probably don't want to be pregnant.
Yeah.
So it's probably adaptive at that time, but this is a different time.
Right. Oh, yeah. And that was going to be my next question to you. Like, because I think something that's not often talked about is like the women's ability to even, be relaxed enough to have an orgasm. And so I think that is also part of the problem with the fertility.
Oh, absolutely.
And I know that is something that I struggled with for a lot of my life. And I want to be open about that because I think it's not something that's talked about enough.
No, I mean, it's in our country, there's a lot of taboos about, especially women's sexual functions, like, it doesn't exist. It's like, well, it does exist,
and it's there for a reason.
And if you look at them, there is a reason God gave us that.
Exactly.
So, and I think the normal function is having sex, enjoying your life, having orgasms, reproducing. Yes. It was meant for us to have that.
Yes.
If you haven't slept and you're pissed off, the other part is not only. So let's say you do get pregnant, and let's say you're still stressed. All those norepinephrine and everything else reduces circulation to to the uterus,
Yeah.
right? So once you have reduced circulation to the uterus of the fetus,
Mm-hmm.
you're going to have small children,
Mm-hmm.
maybe other effects, and they can come out anxious and they have other effects.
Yes.
So the point is, even if you do conceive, the child could be affected.
1,000%. Well, and they're basically then taking your nervous system too. So then there's that, right?
Kinda. I mean, the core, not quite.
In a way.
Well, I mean, they don't have we don't have a direct connection from a human female to the fetus. Not directly, shall we say.
Yeah.
But, like all the stress hormones, like cortisol and
Right.
everything else,
Right.
does affect the child
Yeah.
in a very bad way.
Yeah.
Right?
And we're seeing more miscarriages too.
Correct. So that'll lead, again, miscarriage, a lot of it is due to lack of circulation.
Yeah.
Norepinephrine squeezes the blood vessels. Not
Yeah.
enough of that. So part of the placenta dies, so you don't have enough circulation.
Yeah.
And then the child will come out small.
Mm-hmm.
They can have mental retardation from that, a lot of other problems.
Yeah.
So you want the women to be calm, collected, enjoying their lives.
Yes. Yes.
If you want to produce a normal child.
Yes. Which every woman, I think that's our number one thing. As a woman, you want a healthy baby. That's
well, you have other things besides making babies, but
right. But when you are pregnant,
that
is your
yeah.
That would be
right.
At least
so my point is, even if
mine.
you do conceive, but then even if you do carry the child to term, it could be a problem. So the point is, it's a great thing to fix mental condition issues before.
Yes.
The other part is the chance of postpartum depression goes up significantly if somebody is traumatized before.
Yeah. And that was going to be another thing I brought up too, because I think, we're seeing a lot more postpartum depression.
Right.
And because, after you have a baby, a lot of things come up if they haven't been resolved before.
Right. So the estrogen drops.
Yeah.
And that, a lot of it leads to postpartum depression.
Mm-hmm.
The other part is, right now, if you think about it, the mental state of the United States, the globe is in a very sorry shape.
Yeah.
It's the highest rate of suicides now, both male and female, since 1941. That was beginning of World War II.
I didn't know that, but
right?
I don't.
The preteens are killing themselves at record numbers. So the question is, it could be multiple reasons for that. I think part of it, though, the anxiety disorders could be on the rise because the mothers were anxious. Now the children are anxious.
Yes.
And now they can't really correct them because now the mother is anxious, the kids pick it up, so they get secondary PTSD. Yeah. And there's this whole roller coaster of drama, which isn't bad for everyone.
Yeah. And that's like one of the things I'm passionate about is we must mother the mothers. Yeah. Because the mothers are the foundation of the home. And
there's no women, there's no society.
Right. Yeah.
It's going to be a very lonely, very short society.
Yeah. Yeah. Thank you for going into that. There was one other thing I was going to bring up, just that I thought of. Oh, it's just one thing I noticed in my own experience. I mean, now I'm more joyful. I'm like, I have so
That's
much
beautiful.
less. Yeah, I have so much
you're smiling so much more.
Yeah, when
I
I came in to get the shot myself, I had a huge emotional release. I was very nervous. I felt like a child, really. And so,
you got access to a lot of emotions rapidly.
Yeah. And so
but it's a good thing long term, right? You can get rid of it.
Oh, it was exactly what it was designed to do. And so the other thing I noticed and that I try to teach about too is our womb is the home of our emotions. And so when also we are holding a lot there as women, we can't bring in new life. There's no space. And so what the shot allowed me to do was move through all of these repressed, stuck, heavy emotions that freed up space in my womb. And now I'm it's a freedom that I want for every woman, and for the women especially that are, being told that they're infertile or that they're having to just go straight to IVF, right?
Exactly. It's interesting. But I think intuitively, that's true because there's so many stories about women getting, or the families getting dogs, and all of a sudden poof, they conceive. Right?
Yeah.
Why? It's not dog causing a conception, right?
Yeah.
Because now calm.
Yep.
So a lot of times you use the dog for treatment of PTSD. This is not that big of a stretch.
Yeah. Yeah. So thank you for going into that. Looking at my questions for you.
No problem.
Well, I'm super curious. Why did you decide to call this the God Shot? Where did that come from? Because I love the name, and I think it is the God Shot. It really
It's
is.
sweet.
But I'm
Well, I do a lot of work with military. As you can see, you're visiting my office today, and you could look at some of the challenge coins. So I'm very proud of have treated a lot of military. So the gut shot came from a Marine, which I've never met. So I treated another Marine, and he said his body had the block from somebody else, and he's changed his life. So he said, that is a gut shot because it changed my life. So I thought we kind of embraced that.
Yeah.
And then there was a gentleman that I treated. He was a lieutenant in the Army in Iraq. So he also a great writer.
Yeah.
He had all type of psychiatric issues. And then he came in because Playboy of all journals wanted to do an expose about Stellate and on him. So he wrote that. And that's the first time it actually came out in print, the term, the gut shot. If you want to read that article, it's on thegodshotbook.com. I actually put the article up so you can look at that.
Okay.
It's hilarious.
Yeah.
And I love the name. It's not because I'm God by any measure. I'm just a good helper, I hope. But I think it kind of gives you a feel that the life is not over.
Yeah.
You know, you need hope and you can change your life. And that's hopefully we can do it through a simple injection that doesn't take long and the risks are low. So
yeah. Yeah, it changed mine. And so that's,
One more time.
Yeah, that's why I want to just help bring more awareness to it. And
absolutely.
And the piece too that I think would be helpful just to kind of hear you speak to as well, like the integration was really important for me.
Right.
Right. And so it's not like you get the shot and everything is fixed.
Right.
Right. It's like you get the shot and it opens the doorway to healing.
Right. So let me give you an example, actually. This is a male example, but, same thing.
Yeah.
So we took care of, not I did, but, I'm a chief medical officer for international company. We have office in Australia, in Sydney. So we took care of a patient that was a policeman. And he said his job was to take dead bodies out of tunnels for years. So he was being taken care of by a psychiatrist who gave medication, and he also did psychotherapy. No progress, 5 years. And then he had the block. In 2 weeks, he made more progress than in 5 years. And he was able to come off the meds. So, because the problems are not gone. Like my favorite psychological intervention, it was designed by Dick Schwartz. It's called somatic psychology. Mm-hmm. So it's integrating the body and the mind, which makes perfect sense. So and doing meditation, I think is great because it grows brain tissue back and it gets you really ready and thinking. So those are some get to nature, exercise, like you're athletic, do athletic things, eat well, all of that. So it is important to do all of this. So you're doing everything you're supposed to do. Plus, you know how to meditate. But the problem is until you can calm down your system, all the meditation in the world and deep breathing ain't going to fix it.
Exactly. And that's where I was at. Right. I'd been on my healing journey for so long. Yeah. And
you look very athletic and very healthy, yet you cannot control that system.
Yes. Yet no matter what I did, I could not get out of fear. I could not get out of hypervigilance. And so then when I got the shot, things started to come forward. And, I'm a detox specialist. So I teach people how to physically detox the body. And so that came in that was one of the most powerful tools as I was, working through having the shot, because what it felt like for me was that everything that was repressed almost felt like it, flooded my body in a way so I could access it. So that I was doing, daily enemas, I was doing juice cleansing, I was doing all the things. And then, Charlotte, who I introduced you to, who just got the shot today, she helped me really integrate from an inner child healing perspective.
Right.
And so
I think she has a great perspective on how to, she's also doesn't try to shove you into a particular psychological model, which I like that.
Yeah.
And then she met you where you are. And again, she's very athletic, you're athletic, and you guys are both young women. You need to find somebody who you're comfortable with. And you did.
Yes.
Which is actually a fascinating story how you did, but maybe we can catch it tomorrow morning when she didn't want to Charlotte did not want to get on the podcast because she had a droopy eye. That's one of the
She
normal
just
effects.
got it.
She's like, we don't want to be a pirate today. No pirate with Charlotte today.
Yeah.
No. Arr, get it. No.
Yeah. So part of what the work that we're doing is we're working on putting together an integration program for people. And so I'm just trying to think if there's anything else. I guess the last question that I wanted to ask is, have you seen any, just because autoimmune is like so on the rise, right? We're seeing so many more people with chronic conditions.
Yes.
Have you seen success? And like, what have you seen with people that have come in for things like that?
So that's a fascinating question you asked today, actually. So actually, I mean, as we walked in, you may have seen some of my medical students. So we just wrote a very extensive paper we submitted about traumatic brain injury. So the current, TBI, there's two parts to it. First part is when you get bebop in the head.
Mm-hmm.
Second part is called secondary TBI, which is autoimmune reaction. So Stellate's been successfully used for that. So we wrote like a very extensive part of that. But it has been known for the last 10 years that Stellate affects the immune system. Like ulcerative colitis, you can actually see that getting better.
Wow.
Interleukin-6, which is one of the measures for immune system, drops after the block. So there's a whole complex explanation. So have I seen much of that? Not directly, because I have not had the resources to identify them and check the levels. Theoretically, it should work very well for all type of things. Like, for example, I did a block on a young man who had CRPS, not PTSD, he had a burning hand. And he said, it's interesting. So I've had allergies since I've been 6. I have no allergies. Like, stuff like that.
Wow.
Right. So potentially it could have a huge part. The other part, the part of fertility, a lot of times, people they get pregnant, but they miscarry. A lot of that is immune related.
Oh, yeah.
So if you can reduce the autoimmune attack, then there'll be less miscarriages.
Yeah.
So it all makes tremendous sense together.
It does. It does. It could help just about everybody.
Well, I mean, it's not like, hi, how are you? Everybody gets a block. But a significant proportion of people who are struggling, right?
Yeah.
If normal things work, like getting a dog work, you don't need a procedure.
Yeah.
I mean, as an invasivist, I always have to temper the expectations. Like, oh, Stellate for everyone. No. You. Oh, of course. Everybody gets it. No, I mean, there need to be some reasonable attempt to get better. If it hasn't, then I think it's one of the options. It's certainly much better than staying on pills for a long time.
1000%.
And, taking SSRIs when you're pregnant, I don't know what it does. Nobody really knows what it does, and so on. There have been some signs that this works with schizophrenia. And there seemed to be an autoimmune component to schizophrenia, which is really interesting.
Wow, yeah.
So all of that, I think in the next year or two, we'll have a lot more knowledge about that. We're really digging at that.
Amazing. Yay, thank you so much for, can
My
you think
pleasure.
of any other questions?
No, maybe just have me explain why you call it PTSI.
Oh,
yeah, please.
Thank you.
Yeah, instead of PTSD.
Yeah, so post-traumatic stress disorder is a term that was started in 1980 in DSM-3. So it's Diagnostic and Statistical Manual. So the first time that manual started, DSM-1 was in the 50s. So it's interesting. So DSM-1 and 2, the first two versions, homosexuality was a mental condition. Wasn't really embraced by society, and it went away. But the first time PTSD term was used was 1980 again. The predecessor of that was called soldier's heart during Civil War in the U.S. Then it was shell shock, World War I, World War II, it was battle fatigue. Then it was Vietnam syndrome, and now it's PTSD. The problem with PTSD, it's stigmatizing term. So the person who came up with alternative term, his name is Frank Egbert. He was a very famous psychiatrist. He came up with the term Stockholm syndrome, which most people have heard of it. Anyway, so he and a four-star general, Pete Chiarelli, in 2013, went to American Psychiatric Association and said, we need to change the name. The guy's killing himself. And they said no. So then I did a study in 2023, and we asked, if you change the name, will you reduce the stigma? So the answer is yes, they would seek people. I went to American Psychiatric Association, and they said, no, you don't have enough information. So the premise of this whole concept is that if people start to think of PTSD as a biological real condition, there's no stigma. It's like a broken leg. You can have physiological treatment. That's the key. So if you want to help us with that mission, if you go on the website, itsptsi.com, itsptsi.com, there's a survey. I'd like to get as many people to fill out as possible. 3,000 is not enough, so I'd like to get 100,000. But when people say PTSD is invisible wound, my answer to that, it's invisible if you have the wrong scanner. If you have the right scanner, things look different, like functional MRI, PET scan, MEG scan. So the bottom line is, in 2025 or beyond, we should be able to start talking about psychiatry, which is based on physiological changes that is seen. Thus, there's no stigma, there's no shame to having a psychiatric disease. It's a biological disease, just happens to be a biological disease of the nervous system and the brain. Parkinson's, nobody says, like, look at this, you're faking it. Parkinson's, right? Because it's much easier to see.
Right.
While to me, mental conditions are not much different.
Yeah. Yeah.
Anything else?
Thank you.
We good?
I guess, yeah, just last plug. Do you want to do a plug for your book?
Yes. So The God Shot, I think it's an amazing book. Hopefully my best work yet. So my partner, Lauren Edgeldy, is an amazing writer. So it's well written. It's going to be available Amazon and Barnes & Noble. You can pre-order it now on thegodshotbook.com. There'll be an audio version. I'm not reading it, so you can actually understand it. But I think hopefully it'll change a lot of people's lives, and it'll change their lives.
Yeah, that's my hope too. There's hope for healing.
All right.
Thank you so much.
Thanks, buddy.
Thank you.
All right. Let's hit stop.